Hey everyone, thank you so much for joining today. Many of you, I imagine, have been on these calls in the past, or you've responded to the RFI, or you've expressed interest in working with us in some way as part of the COVID response. We do have a number of new things to talk about today, and we have two folks who are going to help us do that. Jessica Steinhoff and Jorge Manresa are in the Air Force, and they're going to talk to us about one of our new opportunities that we have for companies who are providing solutions. So we're going to get to that. I'm going to let them talk for most of the first part of this because they do have to drop off, but some quick ROEs. This call is being recorded. We're going to post it to the AFWERX website after this is done. As you have questions, ask them in the Q&A function in Zoom, and we will respond to them as they come in. We're scheduled for an hour. We don't need to take the whole time, but we will go up to the full hour if needed. And then actually, would you two mind giving real quick introductions, beginning with Colonel Manresa?
Yes, absolutely. Thank you, Steve. So I'm Lieutenant Colonel Jorge Manresa. I am the Chief of Contracting for AFWERX and also leading or actually advising the contract efforts that is supporting the JATF, or the joint team that partnered with Health and Human Services for COVID-19 response priorities that we're working for the federal government. So, I've been kind of on this task force and helped pull together the CSO for the joint team doing the federal response for COVID-19. And what I'm here to do is just to kind of help you just ask any top level questions. A lot of the information is available on the actual announcement itself. So I'll just help to clarify any kind of information that's in there that might not be readily evident to you. And hopefully get some interest for you to provide potential solutions in four of our main areas of interest, which are masks, pharmaceutical, industrial base expansion, screening and diagnostics, and personal protection equipment, industrial base expansion. So all of these, just so everybody understands, just right off the top, the CSO announcement is meant for industrial base expansion in these four areas I just mentioned, and not necessarily for buying end items. So if you're trying to propose end items or availability of end items in these areas, that's not what this CSO is focused on. It's primarily focused on solutions that help expand the domestic industrial base expansion efforts in these four medical areas. So thank you again for calling. It kind of wraps up just my little intro, but definitely here to answer any questions as we go through this hour. Over.
Yep, sir. Thank you so much for being here and giving your time. And then Major Steinhoff, quick intro as well.
Yep, no worries. So Major Jessica Steinhoff, I am the Deputy Director of number 2 to Colonel Manresa, and I'm going to help answer questions in the chat, probably read them off for Steve and Jorge here. So I'm just here to do the same, answer any questions you guys have.
Awesome. Well, thank you for joining as well. So Captain Steve Laverne with AFWERX and Air Force Ventures can talk about a number of these efforts, but I'm not an expert by any means on the items that Colonel Manresa and Major Steinhoff will talk about today. All right, so really quickly, I do want to highlight where you can find the most current info. AFWERX.af.mil. If you navigate to the top, you'll see the yellow text that says COVID-19 National Response Team. And it takes you to this Unite and Fight page. We will have any new announcements there, including these 4 AOIs or areas of interest that we'll discuss today. So recommend bookmarking the site and checking back regularly. The request for industry information that was open for several months is now closed. So we had a very large number of responses. Those folks are not necessarily lost in the ether. In fact, they were among the group that we pinged to let know that these new AOIs were active. So they are still in our system. We're just not accepting new submissions to that. And then the big subject item of today is the commercial solutions opening for the Air Force Acquisition COVID-19 Task Force, or DAF Act. If you go to that AFWERX coronavirus page and scroll down about midway, you're going to see this, this text here. So JATF, Joint Acquisition Task Force, Commercial Solutions Opening. In that, the blue text for CSO announcement actually links to beta.sam.gov, which has the actual solicitation language. And then you can see the specific language for each of the areas of interest below. So again, masks, pharmaceutical industrial base expansion, screening and diagnostics, and then personal protection equipment, industrial base expansion as well. Every one of those will download its individual file, which has the full details. So I'm going to hand it over now to Colonel Manresa and Major Steinhoff to speak on any more details that they'd like to about this.
Absolutely. So thank you. So as you see, what we had was if you have been on the site before, we had a previous commercial solutions opening that's, previously numbered FA 3002-20S0002. And just note that the commercial solutions opening that is now active is an update to that, obviously with a more focused interest on the areas of interest listed on this website. So as you see, the announcement is slightly different. It's FA 7D13-20-S0002. So it's a similar number, but not the same. And obviously, as Steve mentioned, the previous CSO is closed. And also the previous RFI that was on this website is also closed. So what we are now trying to look for is just a more focused interest on, again, expanding the industrial base to kind of strengthen our direct or tangential domestic supplier services, sources, and also increase market resiliency and competition within the medical, pharmaceutical, and other personal protective equipment areas. So I know that our previous CSO and previous announcement was a lot broader than these 4 focus areas. So I appreciate any kind of responses or interest that were perhaps, provided with those previous documents. But as of this CSO's posting, we would like to just, again, reemphasize and impress on the community that we will only be looking at these 4 areas of interest. And anything that goes outside of those will be redirected to other areas in the federal government to perhaps entertain, but they will not be considered for potential oral presentation or proposal requests if it does not fall in line with this areas of interest. So just wanted to kind of put that out there, only kind of in the interest of time. I see there's a question that says the CSO site that it closes, the CSO closes at 3 August and it also says 15 August. So I can bring a little clarity to that. So the CSO announcement is a broad announcement across these, its main solicitation over these 4 areas of interest. So we are accepting solution briefs for the particular 4 areas of interest that you see on the website through 3 August. So I would encourage, if you're interested or have capacity or a solution to help increase the industrial supplier base or capacity in those areas, that you please have your first Spiral 1 response into the email box stipulated inside the AOI. There's an email in that area by the 3rd of August. The CSO itself, which is the overarching broad announcement that brings forth these 4 areas of interest, that does close on the 15th of August. So that's just the one that the 15 August is really stipulated against the broad announcement over the CSO itself. But the date of interest for all potential offers is 3 August if you want to be considered through the whole process. So 3 August is your line in the sand for providing your Spiral 1 submittals for consideration for potential contract awards if it meets the intent of the AOIs. So that's kind of what, big picture. I'll open it up for any questions. If there are any questions that anybody has, I'd be more than happy to entertain those here over the next few minutes.
And sir, is there, real quick, an eligibility question? Are all companies eligible, certain entities, certain size of company?
That is stipulated in the CSO, but large and small, and also I believe research institutions are allowed to participate. So But I would encourage you to look at the opening page or two where it does address the exact language, the exacting language for all, again, all interested offers. So, but I do know that it is for large and small businesses and also research institutions. So.
Got it. Thanks. Let's open it up to questions.
I would add, this is Major Steinhoff, that you would want to check all the broad commercial solutions opening, because that's going to talk to the evaluation criteria for each of the spirals. So you need to understand the umbrella commercial solutions opening, and then your specific area of interest for your subsector. You know, so read the masks, area of interest, pharmaceutical, industrial-based expansion, and then that is where you're going to see what email address to provide your solution to. Each one has a different place in where you're going to submit your solution. And if you have questions, there is a cso.covid at afwerx.af.mil that you could submit questions to. But if you have questions that are specific to your subsector, you would want to submit those questions to that email address submitted for the AOI. So it might be a little bit confusing, and if you have just questions, you can send it to either of those email boxes. They are being monitored daily, and we will get back to you there. So I just wanted to kind of make that known. Just read both things, because there's information in both that pertain to the whole announcement.
Yes, very, very good, Jess. I appreciate you kind of bringing that to light. It's very important for all our partners out in industry to first read the CSO announcement. That is the parent document that stipulates the terms and conditions of everything required to submit. And then the AOI itself goes into further details regarding the areas of interest and what particular items we are looking for in that. So you must use both documents in unison in order to make sure that you provide a complete solution through Spiral 1 and also through Spirals 2 and 3, should you be invited to continue in the process. So just, yeah, I can't stress that enough. You cannot use one document without the other. So please make sure you become very familiar with the CSO announcement, and then pivot to the area of interest that your firm is willing and able to participate in based on that CSO announcement. Over. All right, so I see that there's some questions starting to populate in the Q&A. So Steve, how do we want to tackle those? You want me just go through them one by one, or we're going to type those out?
Yeah, so actually, Major Steinhoff, if you'd be willing to kind of read some, at least while you're on the line, and then you tee them up, and then Colonel Manresa can knock them down.
Okay, roger that. I guess let me jump to the first one. We have a question states, we'll just go right down the line, Jess. So when you're ready, you can
Sure.
clarify the answer there.
We're gonna go
So is a GSA contract need to be in place to provide a submission? And the answer is no. We are not tied to GSA. We're Department of the Air Force. And if you are a firm that's looking to expand industrial capacity, you do not need to be on a GSA contract in order to do so. In fact, you do not need to be a previous defense contractor to provide your solution. So if you've never done business with the government, I would encourage that you do register and submit your solution none the same, because we are open to all available solutions across industry, regardless of how you have played previously with the federal government. Over.
Awesome. And also, Jess, I can read these because I know you're outdoors, I think, and you're in transit. So no issue on my end. I'm going to bring up the next one. So Fred says, what are you looking to procure? COVID-19 products or industrial capacity, etc.?
Yes, we are looking to procure industrial capacity, not products. So this CSO is not centered on products whatsoever. So it's stipulated in the AOI itself what exactly we're trying to look for. So any ideas or solutions that may expand the domestic industrial capacity in these specific areas is what the federal government is looking for right now. Thank you.
Awesome. Great question. Matt says, are multi-institutional consortia eligible to apply?
Again, I would stick to what the CSO states. Again, if you're working as a large or small business entity, that's fine, or in research institutions. So if you fall within those categories as you go in to submit, then I would believe that eligibility will be reviewed and then provided a response to you. So again, I would encourage you to apply. But again, we are looking for specifically what eligibility criteria stated and stipulated in the CSO.
Awesome. Okay, from Alicia, I am assisting a company that is retooling to produce N95, paying out of pocket for machines and supplies. Can someone please contact me at your earliest? So it sounds like you're paying out of pocket to help build out some N95 mask capability. So this is less something where we're going to be reaching out to individuals to discuss their solutions. And that's part of the reason that we created this kind of funneling mechanism via the CSO and AOIs. But I mean, any just thoughts pop in your head on that one, Colonel Manresa?
Yeah, what I do not want to impress on people is that we will be providing any type of direction or guidance into possible solutions before they submit. So I would encourage that if you have a question or an RFI to send before producing a Spiral 1 solution brief, I would submit that to the CSO inbox, which you'll see in the CSO announcement. And then we will answer those. We'll just field it to the right teams. For example, on this one, masks, and see what type of answer we can provide to all interested parties that might be in the similar situation. So again, a good question, but I would actually send that to the CSO inbox, because currently CSO is open, and I want to make sure that all parties have a fair opportunity, and not just those listening in on this call. So, over.
Awesome. Yeah, thank you for that. So from Fred, also, do you have a standard submission template?
Yes, if you go to the CSO, the directions on what is required for submitting at the various spiral levels. So obviously the one of interest right now is Spiral 1. It talks about exactly what we're looking for and the parameters of what the submission should look like. Do we have a template? No. But I believe that the instructions provided in the CSO provide you ample detail to be able to submit your solutions in your contractor format, and also guided by the information provided in the CSO and the AOI together. Over.
Yeah, and as Colonel Manresa is mentioning, it's pretty detailed in the actual solicitation document. So you'll see on page 8 a number of items that discuss exactly what should be in that Spiral 1 solution brief. So good question, and the content in the CSO itself almost presents as a template, though it's not exactly that. That's a very good question. Okay, the next question is, what is the email address for questions? We can post that into the chat, but I also want to mention that it is mentioned in the CSO itself. And I don't know if you know it off the top of your head, sir. Let's see.
No, I don't. I deal with thousands of people per day. So.
In the chat.
You just posted in the chat. Thank you so much. Perfect. Next question from Anthony. Would you consider the expansion of manufacturing for remote monitoring wearable, which can be part of a screening strategy, as appropriate and in scope for this CSO?
What I would do, again, I'm not here to make those determinations on what we would accept or not. What I would encourage you to do is just to look at the AOIs and see if it's something that fits under one of those areas of interest, which it seems like screening and diagnostics might be something. So if you feel as though that solution will meet what's being requested, I would encourage you to submit your Spiral 1 for review.
Awesome. Yep, absolutely agree with that. And then from Tim, what are the top priorities and key success factors for this program?
The key success factor that we're looking for in the federal government is to, again, increase market resiliency, competition, and industrial capacity for medical, pharmaceutical, and other personal protective equipment.
Awesome. Thank you. From Eric. So if we are distributing for a new U.S. company which manufactures 3-ply surgical masks and is also ramping up to produce molded surgical masks for exclusive production, this will be an excellent avenue for U.S.-based production of mask needs. Is this a solution we would submit through our solution brief if we are acting as the distributor for the company? So this one's kind of in the weeds, but perhaps it could be abstracted for an answer, or is this something we can't necessarily touch on?
Well, again, without knowing the details as a distributor as to how you're proposing to provide solutions, it's really hard for me to provide really much more than, again, I would encourage you, if you're a distributor, again, we're not looking for end products, but if you have methods of maybe improving distribution, and if it fits within one of these areas of interest, feel free to submit your spiral. Again, no guarantees whether they fit exactly what the evaluation teams are looking for. But we're looking for all ideas that are relevant to these areas that we are discussing today.
Yeah, and another good point here too is one of the reasons this is done in multiple spirals is to avoid you doing excessive work before you've gotten those initial indications that we're at least interested. So if you go into the CSO, the instructions for that first spiral, you'll notice that it's fairly light for that first submission. So yeah, up to you to make the decision whether or not to submit, but it is one of those things where you'll get an indication before you do your spiral 2 and spiral 3 if there is preliminary interest. Okay, from Tao. When does the webinar recording get uploaded? Later, after this call, about an hour later, we'll have the recording. We'll send it to our web team to update, and then it's usually later in the day or early to mid tomorrow. From Anonymous. When and where was the RFI posted? We have done a tremendous amount of work with HHS and FEMA task force in support of COVID-19. Baxter Healthcare Corporation would like to engage with the JATF on this initiative, given our global manufacturing footprint. Yeah, so the RFI was previously posted to beta.sam.gov, but also to the AFWERX coronavirus page as well. We have since removed that link since it is no longer active. So the current best and only way, at least, to engage with us is via these AOIs and the CSO. All right, from Blaine, who is the customer? Is it Air Force, DHA, DOD, or other? Colonel Manresa, can we speak at all to the stakeholders and customers?
Absolutely. This is a joint effort. This is Joint Acquisition Task Force, is what JATF stands for. And we are partnered with HHS, so Health and Human Services, providing the COVID-19 response priorities for the federal government. So, you know, I'd love to give you like exactly who the customer is. I think the customer is the U.S. federal government and the taxpayer, because this is a joint effort. So you'd be addressing, again, we have various different government agencies working together to try and solve this problem and bring some solutions to bear. So again, we are working in concert at the highest levels with HHS, and the Joint Acquisition Task Force is the one that is executing this on behalf of HHS at this point in time. And again, we do have, I mean, all these different players that you mentioned, FEMA, we're all working in concert and together. So again, Joint Acquisition Task Force means just that. We're all, you know, we're all working with HHS, which is helping to set priorities for execution.
Got it. Yeah, that's helpful. From Eric, he says, okay, so industrial capacity for masks, gowns, and COVID test kits manufacturing in the U.S., for example, would our firms be awarded contracts for the procurement of those goods, or would it be a pass-through transaction direct to government? Now, I'm not quite sure on that second sentence, but it might mean something more to you, Colonel M.
Let me take a quick look at that. Just hold on a second.
Yeah. And Eric, if you want, you could clarify, and once we get to it, we'll tackle the answer once we have clarification.
Okay, so again, yeah, I was just trying to make sure I follow that. So again, we're not buying goods on this CSO. We are buying solutions for, again, increasing market resiliency, competition, or industrial capacity for the medical, pharmaceutical, and other protective, personal protective equipment. So again, if you read the CSO and the AOIs, it'll show kind of more indication of like what we're trying to do and how your possible solution sets might be able to help increase the national industrial capacity domestically for these 4 areas of interest.
Great. From Fred, so follow up to the prior question, we're using metal additive manufacturing to produce injection molding tooling to make N95 masks, currently in LRIP. You know, I think this is one of those things where we can blanket answer that we can't get into the specifics of particular solutions. I don't know if you disagree with that, Colonel Manresa, but I just don't want people to take the time and ask the specific questions just to get turned down by us, which would be unfortunate.
Yeah, absolutely. So exactly. Today's purpose of this meeting is not to answer solution specific or provide guidance on whether it works or not. We don't have the technical teams on this line to be able to answer that, for one. And also, these solicitation is now open and it's under active source selection. So again, please try and keep your questions top level at the CSO, but any specific solutions themselves, I would just encourage you to put that on a solutions brief, read the instructions so you can see the formatting, submit, and then we'll have the appropriate parties review and provide feedback as necessary to help you along the process. Over.
Yeah, and I'll read the first part of this question because I think it can help generically, but please further define domestic industrial capacity and what that means to you, sir.
Sure. So obviously right now, just kind of real lay terms, when you look at our industrial capacity for making, masks, pharmaceuticals, screening and diagnostic, a lot of that capability was offshored to other nations. So what we're trying to do is build out the onshoring, so bring in capability to help onshore some of those domestic supplier sources or build out within our own borders the capability to meet the demands right now that are being placed on our society because of COVID-19. So this is just an effort, one of many, to help try and stimulate and ignite a little more capacity in these specific areas so we can meet future needs and hopefully this will never happen again, but if it does, our country will be more ready to be able to meet its domestic supply demands that we're right now, that we're facing. So that's kind of what's meant by that. We will see what solutions are out there to see what we can do to help spur that innovation and ignite, again, a domestic industrial capacity for medical pharmaceuticals and personal protective equipment.
Great. And then a question for Matt. So does the CSO speak to the timelines of submissions and reviews and approvals? And if not, could we comment on these? So I did a quick scan of just the CSO base document and didn't see this. Again, this was just a 30-second scan just now. Is there anything that we can announce in terms of the amount of time reviewing the Spiral 1 submissions before Spiral 2, that sort of thing?
Yeah, so as soon as it closes, Spiral 1s, we are reviewing on an ongoing basis. So as you submit your solutions, our government teams will be reviewing those as they come in. So to give you just a general idea of what we're working with is as soon as you submit your Spiral 1, within 48 hours, it will reach the review teams that we have established. And then they will probably take, a day or so to kind of look at those. And then when they get to certain milestones, they will aggregate the responses to all offerers that have submitted. So, and then determine if, those offerers are extended an opportunity to participate in a Spiral 2 or Spiral 3 submission. So we are trying to, that's why we are closing the AOIs on August 3rd. To give the government enough time to review all the various solutions and then provide timely feedback. And our goal is to try and have selected and awarded potential solutions, sometime in the early part or middle part of September. So this is a very fast turn, quick turn type of operation that we are doing as a joint team. And so that's why it's very important that if you do have a solution, please provide your Spiral 1 by August 3rd, because as soon as that closes, we will be having a very concerted and very focused effort to look at all those various solutions and then move interested offerers down the selection process for either Spiral 2 or Spiral 3. So this should all be said and done, and again, awards made off of the CSO sometime in early or mid-September. Over.
Got it. And thank you for that. So I'm gonna kind of sanitize or summarize some of the questions just to see if we can answer them abstractly. Feel free to push back on me, sir. But one of them was, what if there's a combination of existing product modification to fight COVID-19? And so this requires a little bit of R&D, and then it's the direct to large scale manufacturing piece. So in that kind of general scenario, that combination of R&D and then manufacturing scaling, if you're combining products, is that something that you think would be within the purview of this program, or is that too far out to consider?
Well, you've got to take a look at, again, some of the criteria that we have established for the CSO is for us to be able to bring solutions to bear sooner rather than later. So that's why we're being so focused and so fast in opening, reviewing, and hopefully getting some solutions on the ground here as we head into fall. So what I would say is, if you have a product modification or a solution that will expand the industrial capacity, but might require a little bit of R&D, I'd say put that in your solution, then put in when you would expect to be able to field that type of capacity, and then they will be reviewed accordingly, based on the criteria that we have and the schedules that you propose. So, so again, I'm not going to say that, that is exactly, that's a solution we're looking for or anything, but if you do have something that you feel that fits the national industrial capacity push that we're having on these 4 areas of interest, then please submit that, and then we'll take all information into account and provide your feedback for your specific one as it goes through the source selection process.
Awesome. And then here's a great question, again, pretty generic, of if they have a solution that kind of applies in multiple of those AOIs, is there any issue with them submitting twice or to one or the other and then cross-flowing between them? What are your thoughts on that?
Yeah, I would say if you have a solution that expands industrial capacity across the 4 AOIs, and what I would do is I would tailor each one to each of the AOIs and submit. So yes, I would say commit. Don't do one peanut butter spread and just put it to all. I would encourage that if you have a solution that fits all 4 areas of interest, that you provide some level of tailoring to each of the areas of interest, and then submit your solution based on that tailoring.
Got it. No, that's great. So a question about were there other programs that we discussed today? We did mention that the RFI had been closed. The other one that I'll briefly cover is the direct to phase 2 SBIR topic for, it was X20.R was the name of the solicitation. That is closed a long time ago at this point. All selection and non-selection notifications have been made, and they're in the process of awarding those that were selected and chosen to be funded. So other than that, note, we've been just discussing the AOIs because that's the new thing for us today. Good question. Okay. So the AOI states existing U.S. Food and Drug Administration emergency use authorization, EUA, or can submit evidence of having submitted the FDA EUA packet. Can you please clarify this? It seems only companies that have worked with the FDA EUA can apply. Is this correct?
Okay, so I believe this is specific to one of the AOIs. Mm-hmm. Again, the intent is to try and bring solutions to bear that can readily bring industrial capacity expansion. So in this particular AOI, again, without being part of the technical team, what we're trying to push there is if you have this FDA EUA submittal or authorization, to please make that evident in your solution brief. This is not intended to limit only to the companies that have that, but I would imagine that if you do have that or a submittal, I would encourage that you place that in the spiral 1, make it known so that way it could be, that piece of information could be accounted for in review of your potential solution. So again, not meant to exclude, but definitely helpful if you point that out and make it evident in your solutions that you do have that either authorization or submittal to the FDA.
Perfect. Our last question we actually have in the Q&A was that if spiral 1 closes on 3 August, and then there's the claim that spiral 2 closes on 15 August, which I'll talk about, there isn't much time to notify a company and give them time to provide the proposal. What should we expect for that time period? So we should clarify, we're not saying that spiral 1 closes on 3 August and spiral 2 closes on 15 August. Spiral 1 is on 3 August, and then we don't have a set date for spiral 2 to close. Is that correct, Colonel Manresa?
Yeah, that is true. So do not get, if you submit a spiral 1 on time by the August 3rd deadline, all those spirals will be taken into consideration throughout the whole process, no matter how long it takes. The only thing that we're doing on 15 August is I close the CSO announcement, meaning that that is no longer available for the government to change or modify that particular CSO, nor will we be entertaining any extensions after that date of the CSO. But for any offerer that has provided a solution by the first deadline of spiral 1, which is August 3rd, they will all remain within the review process, be it through middle September or beyond if the government needs more time.
Great. Okay. Well, that's the full list of questions that we have. And sir, I know you had to jump off, and I think you've already stayed past what you originally intended. I just want to say thank you so much for your time. Any kind of parting shots you'd like to give to the group before you jump off?
Yeah, absolutely. No, all great questions that we received today. Hopefully there's enough interest. We're looking again for all great ideas that could help really help our country expand its domestic industrial capacity. Again, in the 4 areas that we mentioned: masks, pharmaceuticals, screening diagnostics, and personal protective equipment. This is of vital importance to our nation. I think we are in a situation where we're just trying to be able to, I think we're good for the immediate needs, but what we're trying to do is safeguard our capacity for the future, right? So we are building out that capacity, and we're really looking for those great ideas and solutions that we might not know of, might be readily available for us to help invest in, so we can then meet the needs, the future needs of our country for any current or future pandemics that we might have, or any other emergency situation that our country might need to endure. So, you know, barring anything else happen in the future, again, we're there to just help build out that capacity, and anything you guys can do out there in the economy to help us hopefully meet those ends would definitely be good for our citizens here in our country, and also tangentially to citizens of the world, because as we build our capacity, we definitely have greater opportunities to help our partner nations and allies in the future as well, should, God forbid, anything of emergency or disaster happen anywhere in the world. So this is a great opportunity for you to just be a part of our national response and our national capability, and we're really, really open and happy to receive solutions and hopefully open up our bandwidth a little bit here to help the current situation and future situations that might be. So thanks again for everybody. I appreciate your time, and I do appreciate everybody's patriotism in partnering with us, the JATF and HHS, in our COVID-19 response programs. Thank you very much.
Awesome. Well, thank you so much, sir. We will be here at the same time next week to answer questions. Colonel Manresa may or may not join, but hopefully we can get someone from the AOI team. But again, just thank you all for joining today. We will be posting this recording either later today or early to mid tomorrow. Have a good rest of the day and stay safe out there. Bye, everyone.
Thank you. Stay safe.